Hello, everyone, and welcome. My name is Olatunji Balogun, and today I will be discussing palliative care. Palliative care is a very broad topic, and for today's presentation, I will be introducing palliative care and discussing the history behind palliative care. So, what is it about? Who is involved in palliative care, and why does palliative care exist? I would also be discussing recent evidence-based information in regards to palliative care. So I will be reviewing an article. The ways in which to improve palliative care will also be brought up, as there are different ways in which palliative care can become better and can be improved to better society. Palliative care in the media will also be discussed, and as I'll be presenting a video and also some recent news that has been the talk in the media. I would then conclude my topic, which is on palliative care, as well as summarize my whole presentation today. Join me on this ride as we discuss palliative care. As the average age of Canadians continues to rise, having a solid end-of-life care plan has become more critical than ever. It is projected that between the years 2005 and 2036, the number of seniors living in Canada who are over the age of 65 years old will increase by 25%, and the number of deaths by 65%. At the end of their lives, most patients will end up being hospitalized and some are put into the intensive care unit. However, according to one study which examines the end of life care in Canada, at least 70% of these elderly patients would rather have a less aggressive treatment plan in which the primary focus is to provide comfort rather than a plan, but that is based solely on technological support. As the average age of Canadians continues to rise, having a solid end-of-life care plan has become more critical than ever. It is projected that between the years 2005 and 2036, the number of seniors living in Canada who are over the age of 65 years old will increase by 25%, and the number of deaths by 65%. At the end of their lives, most patients will end up being hospitalized and some are put into the intensive care unit. However, according to one study which examines the end of life care in Canada, at least 70% of these elderly patients would rather have a less aggressive treatment plan in which the primary focus is to provide comfort rather than a plan, but that is based solely on technological support. What is palliative care? An old definition defines palliative care as a holistic service that provides comfort and dignity for any person who is facing life-threatening illness, regardless of care setting or the expected duration of life. A new definition by the World Health Organization as of 2013 defines palliative care as an approach to care aimed at helping to improve the quality of life for patients and their families through the progression of a serious illness. The Canadian Institute for Health Information and Technology also states that palliative care is a care for those in decline who are deemed to be terminally ill or dying in the near future. The focus of palliative care is to preserve the quality of the recipient's life so that their suffering is minimized but the experience of life is not. Not only does this care address a person's medical needs, but also their physical, spiritual, and emotional needs and the families and caregivers even after the death of their loved ones. Canada's population is steadily growing and people are living together than they ever have before. As we can see in the picture, Canada's population is currently at 35 million, and this could exceed 40 million by 2036, according to Statistics Canada. The population is aging steadily, with more than 4.7 million Canadian aged 65 and older, and 1.2 million of those over the age of 80. As the average age of Canadians continues to rise, having a solid palliative care or end-of-life care plan has become more critical than ever. It is projected that between the years of 2005 and 2036, the number of seniors living in Canada who are over the age of 65 years old will increase by 25% and the number of deaths by 65%. At the end of their lives, most patients will end up being hospitalized and some are put into the intensive care unit. However, according to one study which examines the end of life care in Canada, at least 70% of these elderly patients would rather have a less aggressive treatment plan in which the primary focus is to provide comfort rather than a plan that is based solely on technological support. The ultimate goal of palliative care is to try and relieve patients and their family members suffering by taking into account their physical, psychosocial, and spiritual needs. In order to achieve this, palliative care provides relief from pain and distressing symptoms, helps the patients to understand that death is a normal process which every human being eventually experiences. It offers a support system for families to help cope with loss and grief associated with losing a loved one, and it uses a team approach to address the needs of patients and their families. Next, we will be discussing WHO. WHO provides palliative care. Historically, religious and charity organizations were the primary providers of palliative care, although due to the rising numbers of chronic illnesses and increase in life expectancies, traditional healthcare providers have now adopted this role. Before the modern approach to palliative care was developed, the physician was left with the responsibility of deciding what ultimately happened to the patient. There is now a shared decision making approach which involves the patient, their support system, as well as a healthcare team. Ultimately, the final decision now rests in the hands of the patient in guiding their end of life care. The palliative care planning process starts with the patient as well as the family members in discussing the option that would be best suited for the individual. From there, nurses and doctors, as well as psychologists, nutritionists, and other healthcare providers are all a part of the interdisciplinary team who will provide palliative care near end of life stage of a patient. Many different factors can impact the way in which a person will receive palliative care. For example, religious beliefs and cultural norms can play a significant role. Patients coming from different cultures may not be familiar with their rights to autonomy and have the capability to choose the type of palliative care they receive. For example, in the Philippines, doctors are held in a very high regard, thus granting them authority to determine the dying process of their patient. As mentioned previously, one of the main goals of palliative care is to try and alleviate some of the pain and suffering that is associated with the end of life stages of many chronic illnesses. However, in some cultures, the experience of pain is seen as a positive phenomenon and a test of one's faith, or as a punishment for all the sins they may have committed throughout their life. Consequently, this can result in a patient refusing Western medical practices. Furthermore, in the Vietnamese culture, there's a correlation between health and religion, and so suffering with an illness is viewed as part of a natural course of life. Vietnamese Buddhists believe that life should not be prolonged as everyone has a predetermined end set that is decided at birth. Towards the end of this video, where I discuss palliative care in the media, I would display a video about nurses in India who have treated patients and their responses. Right now, depending on the geographical location, only 16 to 30% of Canadians currently have access to or receive palliative care. Even fewer are given the opportunity to receive grief and bereavement services. Bereavement meaning a period of mourning after a loss, especially death. Even with these services available to them, 34% of Canadians are still unsure of who palliative care is meant for. However, most Canadians that are aware agree that palliative care greatly reduces stress and burden placed on the family, should incorporate a variety of healthcare providers, improves quality of life care for patients, and should be provided in a setting that the patient chooses. Worldwide, it is estimated that 20.4 million people will need palliative care near the end of their life. The biggest proportion of these individuals are over the age of 60 years, with slightly higher percentage for those who are male. Overall, the greatest amount of those who need palliative care died from either a cardiovascular illness or from cancer. Respiratory illness, HIV and AIDS, and diabetes are all diseases which can cause an individual to be in need of palliative care, but to a lesser extent. From the map shown in this presentation, it is clear to see that the greatest percentage of individuals who are in need of palliative care live in the European as well as the Western Pacific regions. In terms of palliative care for HIV/AIDS, the highest rates of people who are in need of this service are living in the African and Southeastern Asian regions. Palliative care is a broad topic in the healthcare field and is always being researched. The peer-reviewed journal by Clemona and McPherson discusses the impact of palliative care provided in homes. This was received through the PubMed database by the researchers using articles that utilized palliative care in nursing homes. Inclusion criteria included articles which evaluated the care provided by nursing homes. Articles were excluded if the studies did not consider family members and if they were reviewed in a language other than English. Both of the authors reviewed data and extracted from the studies. After exclusion criteria was applied, 10 articles remained for the use of the authors' data extraction. This study outlined and demonstrated that a reduction in medical expenditures were in nursing homes, which revived palliative care work. Also, the number of hospitalization significantly decreased when palliative care is implemented in nursing homes. Evidence is shown in this article that palliative care improved the patient's pain management. The researchers also reported that the residents of the nursing homes provided with palliative care received more adequate medication than those in the hospital. There is a fair amount of evidence that proves palliative care has the potential to benefit disease outcomes by alleviating pain and debilitating symptoms and decreasing the use of uncomfortable treatments such as feeding tubes and reducing the unnecessary amount of medication used by nursing home residents. However, this article did not provide a list of articles that they excluded. None of the 10 articles which the researchers used for data were randomized control trials, which is known as the most particular form of research. Also, the researchers also admitted that the patients used within the studies were mostly Caucasian. Lastly, only 2 of the articles were cohort studies. Next, I will be discussing ways to improve palliative care. The first being promoting education and self-management. Education and self-management can help to reduce stigma surrounding this type of care. For example, who this type of care is intended for. Consistent self-management can encourage individuals to visit their physicians frequently and help diagnose complications earlier. Next, patients should be consistently assessed by clinicians for pains, dyspnea, and depression, all which are common during the end-of-life stage. I will be discussing this further. By doing so, the correct therapies can be provided to treat complications that arise. For example, administering drugs such as opioids and non-steroidal anti-inflammatory drugs to manage the pain from cancers, oxygen masks to provide the relief of hypoxemia, and support structures to help combat depression. Still discussing ways palliative care can be improved. Palliative care providers can significantly reduce their patients' risk of unnecessary physical and emotional discomfort if they meet the minimum of 5 quality measures, which is stated in the PowerPoint right here, according to a new research published in the Journal of Pain and Symptom Management. During this research, the researchers identified the best available set of measures to help evaluate whether they are delivering the highest quality to patients who have palliative care needs and their families. But palliative care is not one size fits all, according to the Wall Street Journal. Most palliative care models are designed for adults and more generally perceived as only for hospice patients in terminal conditions, which means that organizations must adapt palliative care. For example, while most adults palliative care patients have cancer, children typically have genetic or neurological diseases, which means patients and their families have to deal with a broad array of specialists, complicating the decision-making process. Pediatric palliative care teams help simplify and clarify these processes for families, according to the Wall Street Journal article. Such guidelines are also useful in other care settings. Also, a 2014 study found healthcare workers improved patient outcomes in 4 areas after training in palliative care. Now, let's discuss palliative care in the media. The above picture was retrieved from the Asian Pacific Hospice Palliative Care Network, and this was a trending topic in Asia. Actually, it is still a trending topic in Asia, as people pay out of their own pockets for healthcare. According to the World Health Organization and World Bank Group, report shows that 6% of the population across 37 countries were tipped or pushed further into extreme poverty because they had to pay for health services out of their own pockets. When the study factored in a poverty measure of $2 per day, 17% of people in these countries were impoverished or further impoverished by health expenses. The report further explains how in the face of a life-threatening disease, patients are thinking of the acute pain from the disease, the high cost of the treatment, and the financial strain the treatment will cause to their families. A financial catastrophe can be avoided when one knows the realities of the situation. The huge debts which may have been incurred from the extensive treatments will leave most families struggling financially. Instead of pursuing fertile treatments, pain relief and symptom controls are administered to let the patients feel better. But I have better news. As of October 2016, the Lane Collaborative was launched, which is a project by the Asia Pacific Hospice Palliative Care Network, APHN, and Lane Foundation to enhance palliative care leadership and capacity in developing countries. New palliative care services have started at key government hospitals and cancer centers in Bangladesh, Myanmar, and Sri Lanka by the participants of the Lane Collaborative. A lot of focus was turned onto the remarkable work being undertaken by the international teams and local stakeholders from this initiative. The result is life as the result is life as death, a breathtaking documentary film that delves into the world of building palliative care capabilities in Asia. Don't worry, I will not bore you with the movie. Next is a video called Last Words by the Indian Association of Palliative Care in order to create awareness about palliative care. Nurses will be displayed in this video who will be discussing the last words that their patients shared with them. And just to know what palliative care did to their patients, how it changed them and helped them before they passed away. The video above, Last Words, is a film made for the Indian Association of Palliative Care. It really does touch me. Palliative care is an alien concept in India, which just in 1 in 100 patients in need actually get it. Awareness about this stream is the biggest hurdle, and this film is an earnest attempt to bridge this gap and make palliative care popular. The film draws insight from nurses who happen to be majority who hear the last words of dying patients rather than the family members. When nurses across India recount the last words that they have heard, it just not leaves a lump in the throat, but also raises the alarm. Important questions. Do the dying deserve dignity? Should not the quality of death be as important as the quality of life? The end is a new beginning in this direction from what we can see in this video. In conclusion, I hope my presentation has helped to emphasize that palliative care is very important and will remain to be important as Canadians continue to age, as people in the world continue to age. There are still lots of gaps in research, and so further research is required to help improve palliative care. Again, thank you for viewing my presentation and listening to me. If you do have any questions, feel free to email me and I will respond. Thanks again and good luck.